coming here to Ascension Providence Hospital, and you're teaching the health and well-being program at Psych K. So how do you feel about that, being in a hospital setting?
Wow, Mary, yeah. Thank you for having invited me to teach in this beautiful environment. It's the first time that we do this health and well-being workshop, Psych K health and well-being workshop in a hospital, and we are so grateful, first of all, to all the medical doctors, to all the nurses that do such a precious job for the health and well-being of people. And they take care really of very severe conditions related to health and well-being. And what we do could be a really good complement to what allopathic and also alternative health do, because we really take care of we do not take care of the symptoms, okay? We take care of the life of the person that does not, and all the things in the life of the person that does not allow the person to manifest health and well-being. Okay, so absolutely Psych K is not a substitute for medicine, it's rather a complement. That's why, again, thank you as a nurse and thanks to all the medical doctors and all the therapists that work and help people with their health. And with Psych K, we can really be a beautiful complement in helping people reaching an optimal health and well-being state, again taking care of their life and not focusing on symptoms. So why a health condition manifested at a certain time? What happened in your life? How was your family? How was your job? Did you experience a stressful or traumatic event? And with Psych K, we can work with that in a very effective and simple way, working with our subconscious mind that also affects all our autonomous nervous system. What about you, Mary? What did you get from this experience also done in this environment? I'm really grateful to.
Yes, I'm so thankful and grateful, and I've been a nurse for over 26 years, and I help moms have babies, and I'm so thankful for the medical profession because it saved lives, right? I mean, there's a lot of things that can happen, and it's important to have that safety net.
Yes.
So, but I have found just in my own personal practice in nursing that there's just so much more that we're not helping our families or our patients with, especially stress and anxiety and all the emotional aspects that go around, at least from my perspective, of childbirth, and I'm sure other nurses would say in the fields that they're in, but I'll just speak from birthing. I've used this, and what I've used with what I've learned in the health and well-being is so beautiful that the patients I take care of, when if they're in a very stressful situation, that we can help assist them to transform those realities in very simple and profound ways.
Yeah.
So it's a beautiful complement, and more important is I begin with myself first.
Yes, always.
So as the person taking care of our moms, is I make sure that I'm well before I go in and take care of somebody else, which has been huge, and I didn't do that for a long time. So now that I can be at more of a whole and optimal well-being state, when I walk into the unit that I work in, it's beautiful. The energy is just more peaceful, and kinder things happen. So even just changing my own environment in the workplace, in a hospital, using these principles has been absolutely transformational. So thank you.
And I really think that the beauty of what we are doing is that Psych K is really a very simple and effective and practical way to make changes in our life. So it's not something that takes forever, that's complicated to do. Really, everyone can do that. Clearly, who is curious and who feels attracted.
Sure.
this methodology.
Beautiful.
And there are so many applications in the health and well-being and in life in general, not only health and well-being.
Right. And my vision is I intend to inspire other nurses and doctors and healthcare workers to step into this too for themselves, their own personal healing, and then anyone else that would love to have that in their lives, because really we all are in the same deep petri dish.
Yeah. Exactly.
You know?
And it would be if because a few medical doctors or doctors in osteopathy or therapists have attended the all Psych K workshops, including this one, and they were so happy to have these tools to apply in their job, because the first time they thought, oh my God, if I'm going to ask this question, if I'm going to try to understand more about what's going in the life of this person, it will complicate terribly my job and I will be lost. And it's exactly the contrary. Once we integrate the way on how to find out information and to help people in an easy and effective way, actually doing a profession health related is much easier. Much easier.
Yes. And here you are, an osteopathic doctor and a Psych K facilitator, instructor. So you've learned to do that?
Yes.
Yes, yourself.
Saved my life. And it simplified my life so much. Oh my God.
Yeah, so we can enjoy our lives,
Yes.
right? Yes. That's why we're here.
So,
To enjoy our lives. Well, thank you.
thank you, Mary. Thank you,
was
Mary,
beautiful.
and thank you
Thank you.
everybody who contributed to that.
Yes, thank you. And thank you who else was listening.